Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston, and I'm continuing on in my series where I discuss best aesthetic procedures for every decade of your life. And today we're talking about people in their 50s. So I have to say personally, this is an amazing decade. There's clarity, there's excitement, there's accomplishment and wisdom, and it's quite an amazing time. But there's more that we need to do to maintain vitality and youth and maybe look as good as we feel. So what are some things that we're talking about? So skincare. So the normal washing, using an exfoliant multiple times a week, hydrating, using a sunscreen, that's all recommended, but we need to step that up. And so using more perhaps aggressive retinols, even considering Retin A, could be quite effective. And then using non-invasive treatments that are energy-based to help improve skin. So IPL, laser resurfacing, chemical peel. Some people at this time even consider an ablative laser resurfacing, which is sort of my Cadillac of skin treatments that has some significant downtime, but can be hugely impactful, improving texture, contour, brown spots, and just overall skin improvement. So injectables still play a role in this decade. Botox is really necessary every 3 to 4 months, I think, for both men and women at this point. And then volume enhancement with filler, also still important at this time and maybe a little bit more needy. Mid-face, we tend to lose some of that at this time, so increasing that with hyaluronic acid like Juvederm or Restylane, and then perioral filler can be done very cautiously but effectively. Also thinking about perhaps a biostimulant called Sculptra. So this is not for everyone, but it's something to think about and discuss with your injector if it's appropriate for you. The thread procedure is a non-invasive way of addressing laxity of skin, specifically the lower face, but also mid-face and neck. This is a procedure that's temporary, but can be quite effective for both men and women. Now, what are some surgical procedures that are good for patients in their 50s? Well, there's a lot, okay? For men, we're still thinking about being bothered by their chest, so gynecomastia procedure, abdominal and flank liposuction are very often requested, as well as liposuction to the neck. But laxity of skin plays a significant role, and then now that's where surgery comes in. So neck lift, facelift, upper and lower eyelid procedure for men can be quite impactful. Now for women, same thing, but now we talk about still the effects of maybe having had children a decade ago, so breast procedures, and women may have had breast implants some time ago, so thinking about exchanging those, as well as a breast lift or breast reduction, and then certainly an abdominoplasty is sort of the number one thing I like to do for women who are bothered by the contour of their abdomen. So I hope this was helpful. If you have questions, let me know, and please follow my blog. Thanks.